Opening narrowed heart valves without surgery is by enlarging them with balloons introduced into the heart through blood vessels. The procedure is known as balloon dilatation or balloon valvotomy. An artificial valve mounted on a balloon can be implanted after that if needed. There are four valves for a normal heart. The mitral valve or bicuspid valve separates the left upper chamber from the lower chamber. The aortic valve separates the left lower chamber from the aorta, the largest artery of the body carrying oxygenated blood. The tricuspid valve separates the right upper chamber from the right lower chamber, and the pulmonary valve separates the right lower chamber from the pulmonary artery. Pulmonary artery carries blood to the lungs for oxygenation. The function of a valve is to prevent backflow of blood from the next chamber or vessel and to permit unidirectional flow to maintain blood circulation. Narrowing of a valve is known as stenosis. So there can be mitral stenosis, aortic stenosis, tricuspid stenosis, and pulmonary stenosis. Narrowing of each valve causes blood to pool up behind it and increase of pressure in that chamber. Valves which are narrowed used to be enlarged surgically in the bygone days. Now there are techniques for opening narrowed heart valves without surgery. Small tubes known as catheters are introduced into the heart chambers through tiny holes in the groin skin. They are guided to the heart through veins or arteries using X-ray fluoroscopic imaging. Balloons attached to the tip of the catheters can be inflated while across the narrowed valves to enlarge the opening of the valves, thus avoiding a surgery. Occasionally, the valves may become leaky during this procedure. If the leak is very severe, which is a very rare occurrence, the valve may have to be replaced surgically. Most often, balloon dilatation is a convenient procedure for the individual as it avoids the problems of anesthesia and opening up of the chest. Enlargement with balloon is commonly done for mitral and pulmonary valves and rarely for tricuspid valve. For the aortic valve, a new procedure known as transcatheter aortic valve replacement TAVR is gaining popularity. In TAVR, after enlarging the narrowed aortic valve with a balloon, an artificial valve mounted on a balloon is implanted to keep the valve open without leak. Otherwise, leaks are quite common after enlarging a narrowed aortic valve, which can be quite dangerous. TAVR can be done as a keyhole procedure through small holes in the skin of the groin. Currently, the valve is quite expensive, but the cost is gradually coming down as the number of procedures is increasing worldwide. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.